No story about hormone replacement therapy or HRT and menopause is complete without discussing the Women's Health Initiative or WHI. So, let's start from the very beginning. The WHI clinical trials were designed in the early 1990s, keeping in mind the large body of observational studies that suggested the cardioprotective role of hormone replacement therapy at the time. This was the reason why at least 40% of postmenopausal women in the USA were on HRT before the results of the WHI were published. The Women's Health Initiative was one of the most extensive research projects ever undertaken to focus on strategies for preventing heart disease, breast and colorectal cancer, and fractures in postmenopausal women. The WHI originally included three major categories. These were clinical trials, an observational study, and the community prevention study. The former two were conducted at 40 centers across the USA and included over 161,000 postmenopausal women. The clinical trials, in turn, had three parts and enrolled over 68,000 postmenopausal women between the ages of 50 and 79 years. Eligible volunteers could enroll in one, two, or all three of the following trials: the hormone trials, the dietary modification trial, and the calcium and vitamin D trial. The hormone trial, as the name suggests, studied the impact of hormone therapy on certain aspects of the health of postmenopausal women that we will discuss shortly. The dietary modification trial studied the impact of a diet low in fat and high in fruits, vegetables, and grains on the development of breast and colorectal cancer and heart disease. And finally, the calcium and vitamin D trial looked at the effect of calcium and vitamin D supplements on the prevention of osteoporosis related fractures and colorectal cancer. When we talk about the WHI and hormone replacement therapy, we're commonly referring to the two clinical trials which involved the use of either a combination of estrogen and progestin in the form of 0.625 milligram per day of conjugated equine estrogen and 2.5 milligram per day of medroxyprogesterone acetate for postmenopausal women with a uterus, or estrogen alone in the form of 0.625 milligram per day of a conjugated equine estrogen in postmenopausal women who had undergone a hysterectomy. So then why were the two trials that cost millions of dollars and over a decade of work prematurely terminated in the early 2000s? And how did that impact HRT prescriptions globally? Stay tuned and subscribe to find out more.